Hey, good afternoon, everybody. This is Medications Affecting the Nervous System, Part 1. Okay, we're going to jump right in to the drug class benzodiazepine. So benzodiazepines are often called benzos. I'm sure you've heard that before. They're actually a class of depressant drugs used to treat a variety of conditions. They are listed here. Anxiety disorders. And benzodiazepine will help relieve anxiety and panic attacks. They can sometimes be used to treat insomnia. I have seen them used with seizures, muscle spasms. Common names include Valium, Xanax, Ativan, Klonopin. They actually work by increasing the amount of GABA, which is a transmitter in the brain. So benzodiazepines actually have an antidote. The antidote is called flumazenil. It's the only available antidote for benzodiazepine toxicity. So if someone comes in and they've overdosed on benzos, that would be the drug that they're going to give. And you guys know you have to know your antidotes. So what kind of nursing care for people on benzodiazepines? Well, I leave a lot of these blanks, so when I do these in class, you can kind of help fill in. I don't think I should have to read these to you. I think you should come prepared. So we're going to say no alcohol. Why? You need to be able to tell me when we talk in class. No driving. Need to be able to tell me that one too. And risk for something. It always goes back to fundamentals. If you miss the whole fundamentals issue about how people are put together and what goes on with them, then you're going to kind of miss the whole point of this, the risks that go on with this particular medication. So let's talk a little bit about those people who abuse alcohol and opioids. This particular slide is talking about abstinence maintenance, and what abstinence means, not drinking or taking any drugs at all. Okay, abstinence particularly can go with alcohol use, and we know that people have a hard time, if they are an alcoholic, have a hard time not drinking. And they tend to not tell you how much they drink if you ask them and say, can you tell me how many beers you drink a day? If they say 6 beers, they probably drink 12. You'd chart that and you'd say, admits to 6 beers a day. We kind of know it might be more. We know that people go into something called DTs. We know once they get ready and they want to get dry that we do have these drugs, this drug class that we can help them not to drink anymore. The one particularly I want to take note of is disulfiram. It also goes by the name Antabuse. It's on your left as you look at the screen. It's very unique. It can cause a person to be very, very sick if they're taking it and then they go drink alcohol. It'll make them very, very sick. So if think about this as a patient, if someone comes to you and you know they're in rehab or they're trying to stay dry and they know that they are on disulfiram and they tell you how terrible they feel and they're nauseated, they are probably drinking. The second drug listed, naltrexone, is both for alcohol maintenance, abstinence maintenance, and for opioid abstinence maintenance. And the third one is icomprosate, which is for alcohol maintenance. All of them can be used in a variety of ways, but we do know that people have a hard time giving up alcohol. We have 2 drugs listed here that are for withdrawal from smoking, abstinence from nicotine. The first one on your left is called bupropion. It's a drug called Wellbutrin. It's actually an antidepressant, also used as an antidepressant, but it is very, very effective to help people withdraw from smoking. The second drug that you see is varenicline, which also goes with the name Chantix. Now, Chantix is very, very effective for withdrawal from nicotine, but people say that they have these very, very vivid dreams when they have it. So they kind of have some patient education. We kind of want to warn people about that. There are also some over-the-counter nicotine lozenges and gums. I believe there's a nasal spray, and we do see people using e-cigarettes. I don't think they're technically without nicotine in the e-cigarettes, but I do think that's a big debatable thing that you see a lot online now. So the drug buspirone, and this is I have a fun way for you to remember this. It is actually an antidepressant, and it takes a few weeks to start to work, but it's very unique and it doesn't cause the sedating effect. So they always say, don't worry, you can still drive the bus with buspirone. So that's a good way to remember that. It can make patients lightheaded. It can cause constipation. Definitely if you have people that are depressed, you want to kind of pull into your psychosocial kind of issues that we've talked about in the past. I think this is the drug class that most people are most familiar with. It's a group of a drug class called SSRI antidepressants. Okay, that stands for selective serotonin reuptake inhibitors. The 2 prototype drugs are paroxetine and fluoxetine, and that you are probably familiar with those. You're going to see those given all the time. Therapeutic uses, this is for people that, traditionally with people with depression, but I've seen people with anxiety and obsessive compulsive disorder on these medications. It's not unusual. So there are some issues that come up with these medications. Okay, kind of a general umbrella over the medications. I remember all the time we talk to like things about there's some general rules for antibiotics, there's some general rules for cardiac. So this is some general rules for antidepressants. These drugs can cause weight gain. They can cause people to gain weight. The other thing they can do is they can cause something called serotonin syndrome. I want to talk about that on the next slide. You cannot take these SSRIs or not. You cannot take them with the herbal supplement St. John's wort. That's SJW. You cannot take MAOI inhibitors, which is its own category we're going to go over. Tricyclic antidepressants, TCA, or anticoagulants. And you have to tell people these don't work right away. They're not a cure-all for depression. People start on them and 2 days go by and they kind of, I don't feel any better. It's not going to work like that. They're not going to suddenly feel, oh, wow, I feel like my old self again. It's kind of a mixture. You need to exercise and eat right and give it some time before you start to really notice a difference. There's other things that people get. A lot of people have said that they have some sexual dysfunction with these that they don't. The sexual dysfunction sometimes is not worth it to take these medications. It's not worth the side effect. So you have to do a lot of communication skills with folks that are taking these medications. So serotonin syndrome. It's basically a potentially life-threatening drug reaction that happens when you have too much serotonin. So if you don't recall, or I know people say, oh, the book is starting to get old by about week 12. Serotonin is a neurotransmitter. It's a chemical made by nerve cells in your brain. And most people can take a serotonin affecting medication and it's prescribed as long as you're with your healthcare provider. But sometimes a new drug comes on at increased dose and people can get really sick. They start out with diarrhea and nausea. It can lead to fever and seizures and they could die. So this is something you can never take like St. John's wort, the herbal supplement, like with your SSRI drugs too. You'll have too much serotonin. So it's something that comes up in psych, but it kind of has to overlap a little bit here with this particular drug class. This particular slide is about bupropion, which also goes by the name Wellbutrin. It is a stop smoking aid. It's called an atypical antidepressant. This particular antidepressant does not work on the serotonin. It works on norepinephrine. So its uses are pretty well clear here. It can give people dry mouth. I've had them complain of GI and insomnia. It's just, it has all the same kind of rules you have with the other antidepressants that we give. This is about a particular older group of antidepressants called tricyclic antidepressants. The one here that they use as the prototype usually in most nursing literature is amitriptyline, or I hear some of the people that are well known with their online sites call it amitrips a lot because it's going to make you tired and possibly fall. And and you want to be careful because it can alter glucose levels. People say that they get a dry mouth, and obviously it's going to affect blood pressure. We want to make sure that people do not fall. Okay, we just want to make sure they're not overly sedated and having a problem on any of these antidepressants. So this is a very, very old group of medications called MAOI inhibitors or monoamine oxidase inhibitors. The three common ones, Nardil, Parnate, and Marplan. So the big one you see also is phenozine, and so this antidepressant is saved for people who can't be treated by any of the other antidepressants, and there's a reason. This has a lot of side effects. You can't take any medication along with it. They actually have a list here in the picture. They say no barbiturates, no Demerol, no tricyclic or SSRIs or antihistamines. Basically, you can't take any antihypertensive with this medication because this drug, if you have too much of it in your system, can have a complication of having a blood pressure crisis and affecting your central nervous system. If you ever listen to the TV and you hear some of these commercials we have for medication, they'll have a little voice go, people taking MAO inhibitors cannot take Viagra. And that's like for every medication, though, you can hear it. And this particular group of medications also has foods that you can't take that are rich in tyramine. So tyramine, what in the heck are those? Well, there's some pictures here for you. Pepperoni, salami, cheese, beer and wine, nuts. You can't eat any of those things. That tyramine will add to the blood pressure going up. I believe avocado and like smoked fishes are on the list too. Wine, anything like that, because we don't want them to have tremors. They'll get tremors and an elevated blood pressure temperature and start sweating and have a heart rate. So if you don't give these a whole lot because they don't prescribe them just because they are most definitely going to cause a lot of problems. But you got to understand, people go, well, I'm never going to give a drug. Do I need it? You kind of need to know the unusual drugs because when you do give it, you need to kind of know what it is. So kind of keep that in mind. MAO inhibitors, the foods that you cannot eat and the drugs you cannot take, which is quite a few. So this is the end of part 1. Thanks for listening today.